right? Well, a very short, very short on this hypertension and hypertensive crisis, like because this once again most common encountered one. Well, once again, we have got a lot of this thing drugs available like AC inhibitors, what to be given and what not to be given. I think we should know before this we should know certain definitions. Like, what do you mean by an hypertensive crisis and hypertensive urgency or an emergency? Like, what do you mean by an urgency? Are these same, or can this be something interchangeable use? Earlier we used to have a term called as a malignant hypertension, but nowadays we don't use much because we are using much for hypertensive urgency and an emergency. In the case of an urgency, there are elevations without the effect on, or without there is a significant hypertensive effect of on this end organ. There is no significant end organ damage, or there is no target organ being dysfunctioning in the case of hypertensive urgency. Anything which is more than, let us say it's about 160 by 100 or one or more than 180 by 120. But in the case if it is not going to end up, or it is not going to harm the end organ, it is termed as an urgency. It can be sometimes even managed by an oral medication. We need not give an like an IV infusion every time. But in the case of an hypertensive emergency, yes, here the target organs get damaged. They have to be evaluated. They have to be checked up properly. So this is nothing but an hypertensive emergencies where you have got a lot of end organ dysfunction, and thereby you have to start these medications in the form of an intravenous route. Now, just to have a small thing, like how do you are going to classify? Are there any findings for an acute, like what do you mean by acute organ damage? Like in the case of brain, do you are going to see them stroke or ICH, or you are going to have some papillary edema exudates in the case of retina? Are you going to have an acute decompensated heart failure secondary to an hypertension? Are you going to have an aortic dissection, kidneys, acute kidney injury, microvasculature injury? So all these symptoms or all these findings constitute something called an acute organ damage. If there are no confirm and persistent elevation despite of 20 to 30 minutes of quiet rest, even if then the symptoms are now attributable to the blood pressure, if it is yes and no, if it is yes, it is an urgency. Now, here you are going to give a rapid oral agent. As I said you, because they are not damaging the end organs, they are not damaging your target organ. So we can control it even via the medications, via the oral medications. At the same time, in the case you are suspecting some emergency, that is hypertensive emergency, yeah, you are going to admit this patient, start an IV infusion immediately. Then you have to select the drug, which one, like depending on which target organ damage this patient has faced. Depending on it, we may need to go for the infusions and all. Like having this thing over here, just like it's nothing but the same thing, but I'm just telling you like what is the medication to consider. If you're going to have an hypertensive emergency, it's not urgency. In the case of hypertensive emergency, you are giving IV infusions. Here, if the patient is critically ill, is unconscious, is not able to evaluate, and you see a very high blood pressure, yes, you can consider a nitroprusside, but make sure that sometimes there can be a severe. In the case of an angina, yes, nitroglycerin and beta blocker acts well. Intravenous nitroglycerin acts very well in the case of an angina. And at the same time, it works well in the case of left ventricular failure, pulmonary edema also. You are, suppose if you are having a case with some neurological emergency, you can also consider nicardipine. As compared to that of an urgency, you can go with tablet or you can go with an oral, that is oral form. Even you can consider a single shot or a bolus of a labetalol or metoprolol also. This is some thing you can have a look onto it, like what I've got, like hypertensive encephalopathy, because the nitrates which are responsible for lessening the blood pressure are not indicated in the case of an encephalopathy because they cause the risk of bleeding. And the case of an acute MI, well, labetalol works well. And also in the case for NTG also, you have got like acute renal failure, you can have nicardipine, etc. Intracranial hemorrhage or SAH, you can have once again you can have labetalol, nicardipine. Aortic dissection is an emergency which has to be both heart rate as well as the blood pressure need to be decreased. So labetalol is still best drug of choice over here. Acute ischemic stroke, you can have nicardipine or labetalol. Acute LV failure, nicardipine. Furosemide, that is one of the diuretic, can be given, and along with some AC inhibitors also can be added to.